Dr. Chris Palmer, a Harvard psychiatrist, discusses groundbreaking research that could be the missing piece to cure the mental health epidemic. He emphasizes that mental disorders are the leading cause of disease and disability worldwide, and governments are labeling them as terminal illnesses, allowing people to die by assisted suicide. He shares his personal struggle with mental illness and his dedication to finding better treatments for those who are not responding to current options. Dr. Palmer highlights the increasing prevalence of mental illness, citing statistics that show a rise in rates of autism, ADHD, bipolar disorder, and depression. He refutes the common argument that the increase is due to more awareness and recognition, pointing to evidence from school teachers and emergency rooms that indicate a genuine rise in mental health issues. He also discusses the alarming rise in suicide rates and deaths of despair, emphasizing the severity of the mental health crisis. Dr. Palmer introduces the concept of metabolic dysfunction as a key factor in mental illness. He explains that the brain is an organ and can be affected by metabolic problems, leading to symptoms of mental illness. He emphasizes that mental health conditions are metabolic disorders affecting the brain, and the root causes of these disorders lie in the science of metabolism and metabolic health. Dr. Palmer delves into the role of mitochondria, the powerhouses of cells, in mental health. He explains that mitochondria are responsible for converting food and oxygen into energy or building blocks for cells. He highlights the dynamic nature of mitochondria and their significance in understanding the underlying causes of mental illness. He also discusses the influence of genes and epigenetic factors on mental health, emphasizing that many genes affecting mental illness are related to metabolism and mitochondria. Dr. Palmer addresses the common belief that genetic predisposition plays a significant role in mental health disorders. He acknowledges that genes can increase the risk of certain disorders, but emphasizes that there are no specific genes for individual disorders. Instead, he points to a common theme of genes affecting metabolism and mitochondria, indicating a shared pathway for understanding mental illness. He also discusses the influence of epigenetic factors inherited from parents and their impact on gene expression. Dr. Palmer emphasizes the need for better treatments for mental health disorders, particularly for those who do not respond to current options. He shares his personal dedication to finding solutions and highlights the limitations of existing treatments, citing statistics that show low remission rates for conditions like depression and schizophrenia. He also addresses the issue of governments labeling mental illnesses as terminal and allowing assisted suicide for those with treatment-resistant conditions, emphasizing the urgency of finding effective treatments. Dr. Palmer advocates for a deeper understanding of the science of metabolic health as a key to addressing mental illness. He emphasizes the role of mitochondria and metabolic dysfunction in the manifestation of mental health symptoms, such as depression, anxiety, and psychotic symptoms. He highlights the interconnected nature of metabolism, mitochondria, and mental health, and the potential for this understanding to lead to better treatments and outcomes for those with mental illness. Dr. Palmer delves into the impact of trauma on metabolism and mental health. He explains that when someone experiences trauma, their body goes into fight or flight mode, leading to changes in the sympathetic nervous system, hormones, and inflammation. This response is a normal survival reaction, but if it persists for a prolonged period, it can lead to dysfunction in the mitochondria and cells, potentially resulting in mental illness. He further explains that traumatic events can lead to hypervigilance, anxiety, and other mental health symptoms as the body diverts metabolic resources towards self-defense rather than cell maintenance. This can cause cells to malfunction, leading to mental health disorders. Dr. Palmer emphasizes the significant role of diet in metabolism and mental health. He highlights that diet can impact mitochondrial function and overall metabolic health. He shares his personal experience of improving his mental health by switching to a low-carbohydrate diet, which also resolved his metabolic syndrome. He discusses the link between ultra-processed foods and mental health, citing epidemiological studies and animal models that show a correlation between processed diets and increased risk of depression, anxiety, and other mental disorders. He also mentions the association between ADHD, obesity, and other mental health conditions, emphasizing the importance of diet in addressing these issues. Dr. Palmer continues by emphasizing that mental disorders are metabolic in nature and that diet plays a crucial role in addressing these conditions. He advocates for personalized dietary interventions based on individual needs and preferences. He also highlights the potential for healing and recovery through dietary changes, offering hope for individuals struggling with mental health issues. Dr. Palmer shares a compelling story about a woman named Doris who struggled with severe mental health issues, including schizophrenia and suicidal tendencies. At the age of 70, Doris was referred to a weight loss clinic at Duke University, where she was introduced to the ketogenic diet as a dietary intervention. Within 2 weeks of starting the diet, Doris experienced significant weight loss and a dramatic reduction in her hallucinations and delusions. Over time, all her symptoms of schizophrenia went into remission, and she was able to taper off her psychiatric medications. Doris lived symptom-free and medication-free for another 15 years, ultimately passing away at the age of 85. Dr. Palmer explains that the ketogenic diet was originally developed to stop seizures and has been studied extensively for its effects on the brain. He emphasizes the role of metabolism and mitochondrial function in the diet's ability to improve mental health conditions. Dr. Palmer delves into the science of the ketogenic diet, highlighting its impact on metabolism, mitochondria, neurotransmitter systems, brain inflammation, and gene expression. He explains that the diet forces the liver to produce ketone bodies, which fuel the brain and lead to beneficial changes in mitochondrial function. He also discusses the evidence-based use of the ketogenic diet in treating epilepsy and its potential to repair mitochondrial dysfunction in some individuals. Dr. Palmer emphasizes the importance of understanding the biological effects of the diet and its potential to heal the brain. In response to a question about fasting, Dr. Palmer acknowledges the potential benefits of fasting on mental health, particularly in mimicking the metabolic effects of the ketogenic diet. He explains that fasting can improve mitochondrial function, change neurotransmitters, and positively impact the gut microbiome. However, he cautions that fasting may not be suitable for individuals who are underweight or have certain health conditions, emphasizing the importance of safe and supervised fasting practices. Dr. Palmer discusses the impact of sugar on mitochondrial function, highlighting how high levels of sugar over time can lead to mitochondrial dysfunction and oxidative stress. He emphasizes the need for a balanced approach to sugar intake and the potential implications for mental health. Regarding caffeine, Dr. Palmer explains that caffeine stimulates metabolism in cells, but warns against overdoing it, as excessive stimulation can lead to oxidative stress and mitochondrial dysfunction. He emphasizes the importance of moderation and understanding the balance of metabolic function. Dr. Palmer addresses the increasing prevalence of mental health disorders, particularly autism and ADHD, and their potential link to metabolic and mitochondrial dysfunction. He highlights the impact of obesity and diabetes on the risk of autism, emphasizing the role of metabolic problems in parents and their potential impact on children's brain conditions. Dr. Palmer underscores the need for early intervention and holistic approaches to address metabolic and mental health issues in children. Dr. Palmer reflects on his personal experience of living with his mother, who struggled with severe mental health issues and the impact it had on his own mental well-being. He shares the challenges of living in a state of despair and hopelessness, as well as his own struggles with suicidal thoughts. Despite the difficulties, Dr. Palmer expresses a message of hope and resilience, emphasizing that change is possible and that individuals can overcome mental health challenges with the right support and interventions.